So I think the paradigm for HER2 positive breast cancer, it's been such an incredible trajectory over the last few years. When you think about it, I remember trastuzumab. I was just coming out of my fellowship when trastuzumab was approved, and if you move through the most, the realm of HER2 targeting, I think that the things that are coming that are particularly exciting include better small molecules. Neratinib being one, some of these drugs that are, that may in fact be, easier to combine with monoclonal based therapy, or may even be better than the monoclonal based therapy, although I suspect combinations are likely to be the way to go. And I think part of what we're going to learn in the future is also how to be more strategic about who needs all these drugs. I mean, one of the problems with HER2-directed therapy has been such a success story, but all the drugs are very, very expensive. So we've now essentially priced it out of reach for low-income countries. And so as we want to get smarter about this, it's true that some patients may do exceptionally well with just a bioequivalent trastuzumab, and others need dual therapy with multiple HER2 targeted drugs. I do think that the landscape for understanding that from the standpoint of both DNA and RNA sort of analyses and figuring out who benefits from multiple targeted therapies is likely to hit in HER2 positive breast cancer, if anything, earlier than some of the other kinds, just because it's so heterogeneous, and there's already evidence of ways in which we can do better by looking more carefully at the biology using all these drugs, right? If you think about the landscape is so broad right now. And it's an area I would have thought that drug development, pharmaceutical companies and drug developers would move away from HER2, but it's such a tractable target. It's such, there's the oncogene addiction theory seems to hold true in that, you keep targeting it and it keeps working. And so I think that's been a great success story. And I do think that the biomarkers are going to improve past HER2 as its own thing and incorporating a lot of these other markers.